We've come a long way together over the last year. Now we need everybody, we need you to get vaccinated and help put COVID behind us once and for all. It's time for everyone to say they've rolled up their sleeves and gotten their vaccinations. COVID vaccines are safe and effective. Everyone in the Benjamin family has now been vaccinated, even our youngest. Just like we've done, and just like so many others across the Midlands, it is important to protect yourself, your loved ones, and your community. Once you've gotten fully vaccinated, you'll know you've done your part in helping everyone get safely back together again. Take a look, see how easy that was. Vaccinations are free and available from great community partners all across the Midlands. Getting our city and all of our communities back to normal is almost within reach. We're almost there. This is your shot, Columbia.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.
Hey there, it is Wednesday. That means it's Wellness Wednesday. And as you heard, In It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. Good afternoon, I'm Trey Taylor. Well, it's National Health Center Week, and Erica Moore with Spartanburg Regional joins us to talk about the importance of health centers, especially during this medical pandemic, how healthcare professionals are faring during this stressful time, and how to manage the needs of those with pre-existing health conditions. Erica, thank you so much for joining us today.
Thank you for having me. It's great to be here.
Absolutely. We look forward to a great conversation coming up next on Coping with COVID. But first, your COVID community updates. The South Carolina Attorney General says Columbia's mask ordinance is against the law, and if they don't rescind, they could face legal consequences. Now, Mayor Steve Benjamin responded saying the council disagrees and that they are responsible for preserving the lives, safety, and welfare of the city and its citizens. MUSC is one of 100 pediatric centers in the United States helping with the Moderna trial for children. Almost 7,000 kids of various genders and ethnicities are being tested between the ages of 6 months and 12 years old. Officials say the results have been highly effective. Now, the FDA has also asked Pfizer to step up their pediatric vaccine testing. The Delta variant now accounts for more than 92% of all COVID cases at MUSC. And you can get free tuition at Orangeburg Calhoun Technical College, but you must apply by tomorrow. The school has 3 state-funded scholarships for career, health, and technical programs. Now, to apply, as you can see on the screen, you must be a South Carolina resident, take at least 6 credit hours, and have a 2.0 GPA. Visit the school website or call 803-535-1234. Again, all of the information is on the screen. Good luck. SCDHEC has your most up-to-date list of times, dates, and location for COVID testing and vaccinations in and around South Carolina. And check the scroll at the bottom of the screen. Throughout the show, you will see additional locations throughout South Carolina where you can get tested and vaccinated. Now, if you are a veteran, the VA is handling all vaccinations for veterans. Again, contact the VA for more information. And again, the information is on the screen. Several retail outlets are also offering the COVID vaccination. Kroger pharmacies are offering the COVID vaccination. Check the screen for details and log on to the Kroger website for more information. CVS is also offering the COVID vaccination. Now, that includes the CVS locations inside Target stores. Again, you can see that information on the screen, and you can check cvs.com for more information. Now, if you or someone you know is a senior citizen or having some technology challenges, Get Set Up is helping you make your COVID vaccine appointment. You can call the number or visit the website on the screen. Don't miss your shot. You can get free rides to get your COVID vaccination through the Comet bus system in Columbia, South Carolina. Also, vaccines are being held at the Comet location, their main location on the corner of Sumter and Laurel Street, and that lasts through tomorrow. You can go by the Comet main location and get a COVID vaccination. Now, the city of Columbia is also doing testing tomorrow or today. Today's the last day for testing at several parks, Drew Wellness Center, MLK Park. That information should be scrolling at the bottom of the screen. And also COVID funeral expenses. FEMA is still taking applications to reimburse you for COVID funeral expenses. That information is also listed on the screen. You can check that website for more information. Now, there are several resources available if you're having some challenges paying your rent and paying your bills. The South Carolina Bar Association and SC Legal Services has a toll-free number and website for rental and mortgage help. Richland County Rental Assistance Program is still open. You can see that information on the screen, richlandcountysc.gov. SC Housing has a bill and rental assistance program. They're also offering initiatives for frontline workers. And there's also some information from Lexington, the city of Lexington. The city of Lexington also has a bill assistance program, and you can see that information on the screen also. Now, this week is the final week for the Affordable Care Act open enrollment. That's right. The enrollment ends on August the 15th. It's been extended, but it is over this week. So listen, if you do not have health insurance, you can certainly get health insurance. And if you have health insurance, you still need to check the signupsc.org website or healthcare.gov, because there are additional initiatives and additional subsidies available for all of those who are already have their health insurance. Okay. Also, SC Hopes is helping folks. The South Carolina Department of Mental Health has launched SC Hopes to help people who are having some challenges coping with COVID. I'm Trey Taylor, and you are watching Wellness Wednesday. In It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. We are actually streaming live on the In It Together Facebook page. If you need more information, you can post, share, like, and follow. They have got so much information on their Facebook page and on their website if you want more information about a diabetes prevention program. Now, we're also streaming live on the Taylor Made Production page on Facebook. Please go over there and hit like, follow, share, so that not only you can watch Coping with COVID Monday through Friday and First Monday with comedian George Wallace, you can get all of your COVID-related information. We're also streaming live on YouTube. Want to say hi to all of you YouTubers. Thank you so much for joining us. Please don't forget to hit the subscribe button. That's very, very important. Hit the subscribe button. And also we have a presence on Instagram and on Twitter. Now, if you're interested in a diabetes prevention program, check the In It Together website and Facebook page once again for more information. I want to say hi to everyone watching. Anthony Smith Weeks says, hey, Trey, thank you for the information. Hey, thank you, Anthony, so much for watching. Please post and share this information so we can get the message to the masses because it is National Health Center Week. Erica Moore joins us from Spartanburg Regional. She's a certified diabetes care and education specialist manager. Thank you, Erica, again, so much for joining us today. We appreciate it.
Oh, thanks for having me.
Absolutely. So listen, how are healthcare workers faring during the pandemic, the extended pandemic?
It never ends, does it?
Yeah.
So,
I tell you, I call it COVID-19, 20, and 21.
yes. Let's hope for no 22.
Let's hope.
Yeah, we're tired. Thanks for asking about us. It's been a long year and a half. It really has. So I think most people are tired and just hanging in there, doing the best we can, trying to stay positive for sure.
Yeah. So how has the pandemic changed the needs and concerns of healthcare professionals?
Sure. Yeah. A year and a half ago, we had to really change the way we work. A lot of things changed. There was a lot of information changing on a day-to-day, if not hour-to-hour basis. So we were fortunate here at our healthcare system. They tried to keep us up to date, but it was a constant change. And you know how us adults are with change. We're not great. So it was a lot of fear, a lot of misinformation going on as well. We were worried. Our patients were very worried. I think I spent a lot of days, especially at the beginning, just talking to people on the phone, just about their fears and their anger, their they didn't know what to do, their loss of hope, because we weren't sure what tomorrow might bring. as well
Yeah.
as the staff. We all felt the same way. We were in the same boat, not knowing what tomorrow may bring.
Yeah, so it sounds like you had to, as a healthcare professional, not only deal with you, but deal with, and I guess that's always, but I guess, and I'm sure it's been intensified because of the uncertainty and the newness of COVID.
Absolutely. That was a big thing, is just the uncertainty. Nobody really knew what this was or how it was going to affect us. And, the patients were getting it and being very scared. The staff was scared. We had this whole new level of personal protective equipment that was on top of what we were already doing. A lot more emphasis on, wearing the mask, hand washing, just, staying safe in general. So that was a whole nother level on top of what we're already doing.
Right. I want to say hi to Kawan Fitch. Thank you, Kawan, so much for joining us on Coping with COVID. In It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. Please post and share this information out so we can get this message to the masses. We're talking to Erica Moore. She's with Spartanburg Regional in the upstate of South Carolina. She is a certified diabetes care and education specialist manager, and it's National Healthcare Week. Coming up in the next segment, we're going to talk more about her area of expertise and how to manage the needs of those folks who have pre-existing health conditions. But right now we're talking about how COVID has changed the needs of healthcare workers during this National Healthcare Week. So what are some of the specific concerns that healthcare workers have amidst COVID, Erica?
We were fearful of getting COVID ourselves. We were fearful for our jobs even. We weren't sure how that was going to play out. Many people lost their jobs during COVID, and healthcare workers were certainly in that group. Burnout is a big deal. It's just not being able to cope with the day-to-day dealings that we had to do. Many people had to go through furloughs and take short time off, maybe without pay. So that was stressful as well. The stress level was skyrocketing for sure.
Right. And then of course you're thinking, I've got to work, so I've got to come in here, and then I'm, the possibility of transmitting it to my family because I got to go get back home. And I'm sure too, and you tell me if this is right or wrong, there are different concerns pre-vaccine and post-vaccine.
Sure. Yeah, definitely. And we're knowing now more about the vaccine and its effectiveness, and just knowing that the vaccine does help if you do get COVID after you get the vaccine, which we're seeing some breakthrough cases, that you're not as sick. And the people in the hospital now are usually unvaccinated. So we're feeling a little more confident with the vaccine, but still there are those concerns about the vaccine itself.
Yeah, I want to ask, are healthcare workers required to get the vaccine, Erica?
In our healthcare system, no. We're strongly encouraged to get it, and it's free to us. So there's no reason not to get it, but we're not at this point required to get a vaccine. And I think most healthcare systems in South Carolina are not requiring that. I haven't heard of many across the nation that are requiring it yet. Yeah. But I don't see that as a thing that may last. It's hard to say.
Yeah. I want to go back to something you said when we talked about the concerns. You said, a lot of healthcare professionals were concerned about losing their jobs. How was that even an issue in a field where you need medical professionals?
Right. And I work in the outpatient side of things, so we're not necessarily considered essential always, even though I think taking care of diabetes is absolutely essential. But you think about the essential people are the ones in the ER and the ICU taking care of those patients that are really, really sick. And then there's all these other services that healthcare provides, such as elective surgeries, and those just stopped. Elective surgeries, elective procedures just stopped, and that's where the fear came in. When are we going to be able to go back to doing our surgeries or, things like knee replacements?
Yeah.
If it's your knee, it's very important.
Right. How is the morale among healthcare workers right now, Erica?
So I feel like it's improving quite a bit. However, we're still feeling a little bit of burnout just because they're still constantly changing information, constantly changing rules of how we work, how we provide care. So I think things are really looking up. We're all coping pretty well and just supporting each other the best we can, trying to stay positive every day.
Yeah, yeah. Erica Moore joins us. She's with Spartanburg Regional. She is the Certified Diabetes Care and Education Specialist Manager, and she's here talking about the needs of healthcare workers on National Healthcare Week. I'm Trey Taylor, and you're watching Coping with COVID, updates on the pandemic, the never-ending pandemic, and information to help you thrive and survive COVID-19. On Wednesday, it's Wellness Wednesday, and we're sponsored by In It Together SC and the Diabetes Advisory Council of South Carolina. We're going to talk with Erica about diabetes coming up in the next segment. But Erica, I want to ask, are there resources in place for healthcare workers who are dealing with stress, burnout, everything associated with what you are dealing with right now with COVID and now the Delta variant?
Sure. Most places have their own version of an employee assistance program, or EAP. That's always available to employees. Here we have a really robust, what we call work-life balance program. So we've been provided with a lot of resources online and in person just to take care of us. There's also so many virtual visits you can do now with counselors and mental health providers who can just help you cope with day-to-day stuff, and COVID being one of those things.
Right.
But there's tons of online resources out there specific to COVID and just coping with that and doing your day-to-day work too.
So are these resources available to healthcare workers just anyway, or do you have to ask, hey, I'm stressed out right now, I need it? Or is it offered in knowing that you're probably dealing with some stuff? Because here's the other thing, people don't always ask for what they need. Is that the same for healthcare workers?
Right. Yes. We're definitely the worst at taking care of ourselves, right? So it is offered to us. It's pushed out through, global emails. I've seen many emails just to the employees here about the resources that are available within the healthcare system and just overall.
Right.
So I think our wellness team is taking good care of us, or trying to, but it's still the time to take care of yourself needs to really be focused on. We just don't do that well.
Yeah. Are there enough people working to even give you a break?
Right now, I think we're back fully staffed, we're all thankful for that. But, being ill or being sick or healthcare needs just don't stop. So we always have felt stretched.
Yeah.
I think across the board, healthcare workers have always felt kind of stretched thin, and this made us feel even more stretched thin. So we're doing the best we can, hanging in there, but we are fully staffed right now. And
Yeah, that's good. What's the longevity of the profession right now? Are people leaving, and are people entering? Are people coming into the profession?
Yeah. It's a hard field to enter right now. I would be hard pressed if I was getting ready to go to school. I noticed the community college was offering the free tuition.
Yeah.
It makes you wonder if a lot of those people will pick the nursing or the healthcare professions. So I would encourage people to do that. It's a great, rewarding career. However, with the things that are going on right now, it would be a tough call to go into the field. And yes, people are leaving. I've had many people, change careers. They're just like, I'll do something else right now. It's tough. It's really tough.
Yeah. We're talking to Erica Moore. She is with Spartanburg Regional. She's a certified diabetes care and education specialist manager. We're talking to her about National Health Center Week. I want to say hi to Betty Fletcher. She says, hi, everyone. Hey there, Betty. Thank you so much for joining us. And as always, please post and share this information out so we can get the message to the masses. You're watching In It Together. You're watching Wellness Wednesday from In It Together SC and the Diabetes Advisory Council. They sponsor Wellness Wednesday every Wednesday here on Coping with COVID, and I'm Trey Taylor. So listen, Erica, how can families help healthcare professionals?
Just be patient. Just be patient right now. Offer us some grace and just be patient. We're doing the best we can. I feel like there's so many other emotions around COVID right now that those come out in the worst way on people that you don't mean for them to.
Yeah.
So that's my biggest request for families and clients is just be really patient. I've seen a lot of restaurants with the signs up that say everybody's short-staffed. Please be kind to those who came in today. So I think we're in the same boat too. It's just, be kind to those of us who showed up.
Yeah, that's such an interesting point, because here's the thing: everybody's stressed out. Mm-hmm. The healthcare workers, the public, everybody is so stressed out, and that just doesn't make for a good environment,
right.
But I love that you say, just be patient, and let's just give each other some grace. Let's just give each other some grace, because we all are dealing with the same thing. We all may have different sets of circumstances, but we're all in this world dealing with COVID. And whether you are working in it, whether it's, in the workforce or in the healthcare profession, whether you are dealing with it medically because you have it or somebody had it. Maybe someone has passed away. Maybe you're dealing with kids in school. You don't know what's going on with the mask. Listen, it could be so many variables. We're all dealing with something. So let's give each other grace. I love that you say that. Just be patient.
Just be patient. That's what we need the most of right now.
Yeah.
Everybody's dealing with a lot. So we're trying to be patient. And hopefully everybody else can do that too.
Yeah, Johanna,
take care of yourself and build up your own resilience. Because I don't see that things will end. The COVID is not ending anytime soon. So just keep building up your own resilience, taking care of you.
Johanna Bridgette says, thanks for this information. Thank you, Johanna, for watching. And Mel Oliver says hello. And thank you to you, Erica, and to all the people in the healthcare profession, because as you say, Mel, we have to say thank you. We appreciate everything that you've done and that you are doing. And in this situation where no one knew it was coming, it wasn't like, we had a whole year, 6 months or 6 minutes to get ready for it. It was just here for whatever reason. It was just here. And we were all just jumped into the same boat, trying to figure it all out at the same time. Betty Fletcher says, be patient and kind. Yes, Betty, thank you so much. Yeah. So what about the public? Same thing. Just be patient and kind, as Betty said.
Absolutely. Keep on practicing the patience and kindness. If there's anything we can do for each other, it's that.
Yeah, absolutely. It's National Health Center Week. So listen, if you are interacting with a healthcare professional this week, if you have to go into the hospital, even if you're just going for your regular checkup, look, those folks like Erica said, in outpatient care, they're dealing with stress also. They're dealing with the stress also. If you know someone, if you are in a family with someone who is a healthcare professional, just say thank you to them this week, and just say, I appreciate what you're doing. I empathize with what you're going through. Bake them a cake, give them a coffee or something, right. Just as Betty said, and don't forget to be patient and kind. Cheryl Sanders Vernon says, thanks for the info. Hang in there. She says, thank you, Cheryl, on behalf of Erica. Yeah, girl, we all got to hang on in there. Listen, it is National Health Center Week, and we're talking to Erica Moore from Spartanburg Regional. She is a certified diabetes care and education specialist manager. And we'll be right back with how to manage the needs of people with pre-existing health conditions like diabetes, heart disease, and high blood pressure. We're going to talk about all of that and more next on Wellness Wednesday. It's brought to you by the Diabetes Advisory Council of South Carolina and In It Together SC. I'm Trey Taylor. Hey, don't forget to post and share this information out so more people can hear this conversation. We'll be right back.
You can eat what's good to you and good for you, too.
Ooh, yes.
Get the Dash for Southern Soul Cookbook free. All you have to do is ask. It's packed with delicious Southern-style recipes with a healthy twist.
Yummy.
You won't be able to taste the difference, but you will be able to feel the difference.
Yeah.
inbox your email address to the In It Together or Tailor Made Productions Facebook page, and you'll get it straight to your mailbox. The Dash for Southern Style cookbook and a Coping with COVID face mask. From In It Together SC, the Diabetes Advisory Council of South Carolina, and Coping with COVID.
Coping with COVID with Trey Taylor.
Computers, they're a part of our everyday life, but when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821.
Let Palmetto Painting Services take the worry out of your next home painting project. We can paint anything. Our business is about interior painting and exterior painting. We offer services for residential and commercial properties. Restore the life to your home with a fresh coat of paint from Palmetto Painting Services. References are available upon request. Give us a call at 803-546-4570 today.
How will you remember the year 2020?
COVID.
Losing my job.
Working 12-hour shifts in a mask.
Losing my grandma to COVID.
COVID has claimed thousands in South Carolina and strained our health system, schools, businesses, and families. If you're struggling and need to talk, call SC Hopes. That free call can help put you in touch with people who can help. This goes for healthcare workers, teachers, restaurant employees, parents, anyone and everyone. SC Hopes, mental health and addiction support for challenging times.
It is National Health Center Week on Coping with COVID. We present Wellness Wednesday every Wednesday here, and SCDHEC, the In It Together SC and the Diabetes Advisory Council present Wellness Wednesday. Listen, if you are interested in a diabetes prevention program, check out the In It Together website and Facebook page for more information. They have a wealth of information and resources available. We are actually streaming live on the In It Together Facebook page. Please go over there, hit like, share, and follow so that you can find out everything going on with In It Together. Also, we're streaming live on the Tailor Made Production page on Facebook. Please go over there and hit like, follow, and share so that you can watch Coping with COVID Wednesday through Friday at 2 p.m. Eastern Standard Time, and also first Monday with comedian George Wallace. We're also streaming live on YouTube. Hello to all of y'all streaming on YouTube. We appreciate you. Please hit the subscribe button. Also on IG and Twitter. Post, share, like, and follow. Like I said, it's National Health Center Week, and we're talking to Erica Moore from Spartanburg Regional. The Certified Diabetes Care and Education Specialist Manager has been sharing information on how healthcare professionals are faring during COVID. Don't forget to hit the replay button if you just joined us, and check out all of the great information Erica shared, including how you, as a friend or family member of a healthcare professional, can help them during this stressful time of COVID-19, 20, and 21, as I like to say. We're shifting our conversation right now to discuss Erica's specialty, managing the needs of people with existing healthcare conditions. Erica, what are the numbers in South Carolina for people with diabetes, heart disease, and hypertension? I know we're high up on the totem pole.
Yes. Yes, we are. That's not a race that we want to win, though.
I know, right? We're
That's right.
I tell you, we're high on that, and then we're low in the vaccine, right?
Yeah. We got to flip that around. There's about right now 1 in 7 people in South Carolina have diabetes, adults. So 1 in 7 adults. So look around and at the 7 people around you, at least one of them has diabetes, if not more. And probably twice that number have pre-diabetes and may or may not even know that.
Yeah.
So big numbers. We're usually 7th or 8th in the nation leading in diabetes numbers. So we definitely want to try to make that go away, doing a little more diabetes prevention for sure. And hypertension, usually about 1/3 of adults have high blood pressure or hypertension. So that's a huge number as well.
Yeah.
Big numbers.
You talked a little bit about pre-diabetes. Talk about the difference between pre-diabetes and diabetes. It's just what it sounds like. you don't have it yet, but you're getting ready. You could have it if you don't pump the brakes.
Yes, and if you have prediabetes, which sometimes we call it borderline, a touch of sugar, it's simply the lab results in between not having any diagnosis at all and having the diabetes diagnosis. It puts you in a great place, though, to work on prevention. I think, in my mind, it's a super big wake-up call. It's somebody snapping their fingers and saying, pay attention, you're going down the diabetes road. Let's back up and see if we can prevent that.
How do you know you have pre-diabetes? I mean, even before you go to the doctor, and obviously he gives you your numbers, is there something that people should be conscientious about?
Yeah, so symptoms you can look for, just feeling more fatigued. Symptoms are very vague, feeling thirsty, going to the bathroom more. Those are very vague symptoms, but that's about it. So,
yeah.
And people with higher risk are usually more overweight, less active. Sometimes in certain ethnic groups have higher incidence. So just all of those risk factors going together. And of course, the older we get, the higher your risk goes.
Why is that? Why is your risk higher the older you get?
Yeah, our metabolism just changes the older we get. So we're not
able to process the sugars and salts and stuff like that better. Or not?
Exactly. Yeah. It's just like everything else. No, it's an unfortunate part.
I know, right? So listen, what are the numbers? So when you go to the doctor and he diagnoses you as having pre-diabetes, what are those numbers?
Yeah, so if you get a fasting blood test that's in a lab, not on one of those little machines you stick your finger with, your pre-diabetes diagnosis would be between 101 and 125. So less than 100 is no diagnosis. 101, 125 would be pre-diabetes, and 126 plus is diabetes. And usually they'll run those tests twice just to make sure. Another really common test is called the A1C test. And if you get a number between 5.7 and 6.4, that's your pre-diabetes diagnosis, and 6.5 and above is diabetes.
Okay. All right. Now, the other thing is, if you have diabetes in your family, you need to be conscientious. Is that correct?
Absolutely. It definitely is hereditary and has a family component. So if you have both of your parents or your siblings, definitely get checked out. That's definitely a red flag to stay on top of going to the doctor and getting labs checked. It's amazing how many people don't go even get their annual checkup for years and years. So this is a good way to catch it early. The earlier you catch it, the better off you're going to be.
So it's either one of your parents or a sibling, grandparents or no?
Sure. Yes, grandparents as well. So keep an eye out for all of that. And we used to call type 2 diabetes adult onset, but our kids are getting it at an alarming rate too.
Wow.
So it's just type 2. And so don't ignore those symptoms in kids, or if you have kids and you got diabetes at a young age, don't ignore that and take them in for their test too.
What's happening with kids? Is it more processed food?
There's probably a large variety of things, more processed food. We have all the food we want, right? And not all of it's healthy. And kids are just in general less active. I think, when I was a kid, we did a lot more activity. Now there's just more inside games and things like that. Just TV, lots of stuff on TV to watch. And then kids, unfortunately, are like the rest of us. They're more stressed out. There's a lot more stress in the world these days. So I think all those things go together.
Yeah. I've shared on the show several times. Actually, my brother was on one time talking about diabetes, because every other generation of female in my family had diabetes. It skipped me and went to my brother. So he's the only male. And so I am always, and then both of my sisters died of breast cancer. So I'm always conscientious of that, of that family, that family trait. Yeah. So I'm on top of my mammograms and on top of my, checking my diabetes. And the other thing, and I've said this before on the show, was the high blood pressure, because which, we'll talk about later, why all of them kind of go hand in hand sometimes. That was a big thing with both of my parents. Both of my parents died in their 40s. Oh, my mom died in her 50s. My dad died in his 40s of heart disease. So again, I am conscientious about that. But the crazy thing that makes me crazy is I don't smoke. I do exercise. I do eat well, although I love chocolate chip cookies. But I'm still, I still have to be on top of it because it's in my family line.
Absolutely. There are things we can change and things we can't. We certainly
Yeah.
can't change our parents and what they gave us, but we can change all the things you just said. You know, we can not smoke, we can eat healthy, we can exercise, we can stay on top of our medical visits for prevention. So definitely paying attention to all those preventable risk factors. There's some you can't do anything
Yeah.
about, our age, our parents, but the ones we can, I think we should get on top of those for sure.
Right. Erica Moore joins us. She's at Spartanburg Regional. She's a certified diabetes care and education specialist manager. She's telling us how to manage those pre-existing conditions we've been talking about, diabetes. So what you say sounds easy in theory to manage.
Right.
What are some of the realistic steps that we can take, Erica, to really take a hold if one, we have diabetes or pre-diabetes, if we have diabetes, and if we have a family trait?
Right. So like you said, it sounds so easy, doesn't it?
It does.
We're adults. We don't like to make changes in our lifestyle for sure. My best advice is, number one, look for the big impact changes that you can make that will have a big effect on those numbers. For instance, let's say you drink a lot of soda or sweet tea or juice. That's a big impact change you can make that might not hurt too much.
Yeah.
So start small with a baby step and find a big impact change you can make.
You know what? I just want to, I want to jump in here and say, I think the fact that I drink a lot of water saves me.
Yeah.
You know, I do. Typically, that's 90% of what I drink. Now, I'll drink some tea, some hot tea. I'll drink like a turmeric tea. I may have an occasional glass of wine, but I'm not a soda drinker. I mean, you know, I'm a water drinker. So I think that saves me from calories and everything else. Because I'm gonna have a piece of tiramisu, girl. You know what I'm saying? I'm gonna have a chocolate almond and an occasional French fry. But the fact that I'm not having that on top of a soda, you know what I mean? I think that saves me.
Absolutely. I would much rather eat my calories than drink them.
Exactly.
So get rid of the sugar drinks. Besides, most of those sugar drinks are going to have other stuff in there that's not good for you as well. So water is your best bet. So more water, less sugar drinks. And just add more vegetables to your life. Vegetables, you cannot go wrong. I always say that's my answer. If I ask you a question, just say vegetables, and that's the right answer. But adding more veggies, that automatically helps you cut out other things that are not great for you. So adding more veggies, not breaded and fried.
I was going to ask that. Adding more veggies could be, you know, because now they've got, you know, the fried green beans. Had some yesterday. You know, so, but yeah, just your vegetables steamed, not fried. Yeah.
Right. Yes. So add more veggies, less really high saturated fat foods. The saturated fats in foods that are usually from our meat fats or deep fried foods, those make us more resistant to our own insulin. So that kind of shocks people. You know, they say, oh, I thought it was all about sugar, but the heavy fat, high fat meals, those fast food meals, the processed meats, things like that really make us more insulin resistant. So less processed foods, more real food, more water. And you know, I'm going to say exercise more. Of course.
Yeah. Now, and I want to get to exercise in a minute because I want to know what exercise, how much exercise. But I want to go back to processed foods. Okay. So when we talk about processed foods, are you talking about packaged foods or processed foods, packaged foods?
Right. So a lot of your packaged foods are very heavily processed. So I always think back and say, if my great-great-grandmother couldn't recognize it, probably I shouldn't eat it. So things like that. Of course, there are things in packages that are healthy for us, like frozen vegetables, frozen fruit. That's, you know, technically that's processed. However, it's still just real food. You know, we we have to eat some packaged foods.
Yeah.
That
So are you
person
talking about like bologna, or are you talking about, yeah.
Yes, that's a good one. Yeah, your bolognas, your salamis, sausage, hamburger, hot dogs. Those are all really heavily processed meats, and those are
Yeah.
really hard on your body's ability to use its own insulin.
Frozen pizzas, frozen waffles.
Yeah, all that stuff. And you think about foods in that category, they're more of the processed starches. They're highly refined grains. They may say whole grain on there, but they have really been stripped of their good nutrition and fiber.
Yeah. All right. So let's go to so go to just more fresh fruits and vegetables. But you say with the frozen fruits and frozen vegetables, they're okay.
Yes, absolutely. Yeah, they've just been harvested and frozen for our convenience, and that is really great because otherwise we may not get a lot of those veggies that aren't grown here.
Yeah,
that is a good thing.
Yeah. So, what about calorie counting and reading labels? What are we looking for?
So on the labels, if you're new to label reading, look at the portion size. That's the first thing to look at, is that portion size. That doesn't mean that's all you can eat, but remember, all the numbers on that label are based on one portion size that is listed. And if you're just new to diabetes or starting, we typically look at the carbohydrate count, the total carbohydrate count. And I like to look as well at the added sugars line. That's something on the label that's been added in the last couple of years that I find really helpful.
Yeah.
There's a lot of added sugars. We know the manufacturer put that sugar in the food. So we don't need to be eating that.
I noticed that because I've got babies in my house, 3 and a 5-year-old. So I'm conscious about the cereals, because of course they like Crunch Berries and even Honey Nut Cheerios. Although, but I'm noticing the added sugar and that's just for what?
Yeah. It's a lot. And really the recommendation is to eat less than about 24 grams of added sugar a day. That can add
You can get that in one meal.
Yeah. So that's just a good reference. You can kind of have context on what you're looking at on that label.
I'll just tell, you and everyone, as for if anybody knows or wants to do this with the Cheerios, because the 3-year-old, she loves Honey Nut Cheerios. And again, in theory, that sounds good. But I did notice last week it's so much sugar. So I started mixing it with the regular Cheerios. And she doesn't even know the difference, because you're just mixing it up together. They're all little O's.
That's a great idea.
Thank you. I had some in there. I was like, okay, this is too much sugar. So anyway, we're talking to Erica Moore. She's with Spartanburg Regional. We are talking about how to manage your diabetes and other pre-existing conditions. So what about, so we talked about calorie counting, read labels, sugar. What about salt and fried foods?
Oh yeah, salt and fried foods. And salt can affect your blood pressure. So cutting back on that anywhere you can. And really, we get most of our salt from processed foods. So it's a double whammy. Salt is a preservative. So many of our processed foods are using salt as the preservative. So pretty much anything in a can is going to have salt in it. So cutting back on that will help.
So should we, if we do something in a can, open it up, rinse it out, don't cook it in the water that it has it with it?
Yep, that's a great way to do it. Just strain it out, rinse it off, or even buy the low sodium version. Some things you buy in a can, you may just be able to find that in a low sodium version, and that's helpful too.
Yeah. And then of course, fried foods. Is there anything good fried?
Of course, they all taste great, right?
Look, potatoes, girl. Potatoes are good, I guess. And like we said, fried green beans, that's got to be good. Not so much.
Good for you. Yeah. So it's always great to try to find alternate ways to cook your veggies than breading and frying. And I noticed the cookbook during the break that In It Together has
a
lot of good veggie recipes.
There
Lots
are
of good recipes out there. So anytime you can find an alternate, like I'll give you a great way to cook okra. So because I love okra. And there's a lot of it right now, but we typically bread it and fry it, right? So what I do is I just take it, chop it up, and put it on a pan and just sprinkle it with what you would normally bread it with. Just sprinkle it and then spray it with cooking spray. Cook it in a hot oven, 400, 425 for 20, 30 minutes. And it's crispy, it's crunchy, it tastes like fried okra.
That's good. That's a great recipe. So cut it up really finely, just sprinkle with the breading, whatever, just sprinkle it, and then spray a little cooking oil over it. And then, or could you drizzle it? If you don't have a spray, could you drizzle?
You probably could, or use just like the Pam type of cooking spray. Spray that on there. That works really great.
Oh, that's a great idea. Betty Fisher says Food Share has a great program for fresh fruits and vegetables.
Oh, we love Food Share. We absolutely love Food Share. In fact, we give it out as an incentive for completing the diabetes education groups. So we are big fans of Food Share.
That's great. Thank you, Betty, for the information. So so let's talk a little bit about, we talked a little bit about drinking water, and I said that's my primary source of, fluids. So drinking water is good. Is it true that drinking water kind of flushes your system out, Erica?
Absolutely. It allows your body to do all the things that it needs to do. If we're dehydrated, our bodies can't. All they're doing is working to reestablish the hydration. So stay hydrated with water. Most of our other drinks can be dehydrating. So water should be your primary source of fluid. Mm-hmm.
Is it okay if you add something to it? I know that they've had some of the, whether it be lemon, lime, some kind of fruit, but then I know they have the little stuff that you sprinkle in there. Not Kool-Aid, y'all, but
Yeah, not the Kool-Aid. Yeah, there are a lot of, they usually have artificial sweeteners in there.
Right.
So it depends on if you're okay with doing that or not. Those won't make your blood sugar go up, but we know that they can possibly do some changes in your gut that might make us less healthy.
Oh,
but
wow.
that's the way we're getting our water. I'm always like, that's a better option than soda, right?
Yeah. Cheryl Sanders Vernon wants to know, what about an air fryer?
Oh, yeah. An air fryer is great. That is a great way to do all your vegetables.
So that's okay?
Mm-hmm. Yeah.
Oh, wow. Hey, Cheryl, you're fine. Air frying. Because the concept is you don't use as much oil, correct?
Right. Yeah, you don't use oil, and it makes it crispy, crunchy like it would if you fried it. So that's a wonderful way. A lot of people are using their air fryers, and I think that's a great way to go.
Yeah. Thank you, Cheryl, so much for the question and for bringing that up. We're talking to Erica Moore. She's a certified diabetes care and education specialist at Spartanburg Regional. And you're watching Wellness Wednesday. In It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. Hey, don't forget that scrolling at the bottom of the screen, we've got so many resources available, including where to get a COVID test and COVID vaccination, resources available for bill payment and rental and mortgage payment assistance, and other information scrolling at the bottom of the screen today and every day on Coping with COVID. So let's talk a little bit about the relationship between hypertension, heart disease, and diabetes. And then we'll talk about some of the programs, support groups you guys have offering.
Okay. Yeah, they all go together. They are all what we call cardiometabolic syndromes, meaning that it all ties together. And when we think about diabetes, we usually don't think about the connection to the heart, but that is usually the most common complication from unmanaged diabetes is heart disease, which can lead to heart attacks, strokes. So it's not something we really think about, but they're definitely all related, and they can all be managed with the same lifestyle choices, reducing your stress, getting your exercise, making good food choices, getting enough sleep. All those things go into taking care of all the cardiometabolic issues.
Yeah. How much exercise is needed? I mean, we talk a lot about exercise. So what does that mean? I have a 3-story house, so I'm up and down the stairs all day. Am I getting enough exercise? Do I need to walk every day? I mean, how much exercise is enough exercise, Erin?
Yeah. And all that movement counts. So just taking the stairs, parking farther away, that's all helps us add up more movement during the day. We do need to get some aerobic activity, meaning 10 minutes of consistent activity, whether that's walking, biking, swimming, dancing, whatever you like to do. Try to get at least 10 minutes in a row and let that add up to a goal of 150 minutes a week. So
Okay.
that sounds like a lot, but that's really 30 minutes, 5 days a week. So
Mhm.
that's doable. And it only has to be moderate exercise. We don't have to go run marathons or do anything really intense, just moderate walking, meaning you can talk, but you can't sing. So if you're walking with somebody, you should be able to talk to them, but not sing.
Okay.
So
Okay.
about 150 minutes a week. Also,
150
it's really
minutes a week.
important to have a couple of days of resistance training, whether that's weights or bands or just using your own body weight to do things like squats or wall push-ups. We especially need that as we get over age 30, as our muscle mass starts to decline. So definitely add that in a couple of days a week as well.
Yeah. Betty Fisher says she loves her air fryer. Thank you so, Betty, for so much for your comment. I know that there are several support groups available, and I think that's great. I mean, In It Together sponsors this segment, and they've got amazing resources on their website and on their Facebook page. And we've had several people on. Tell us about some of the resources available through Spartanburg Regional.
Yeah, so we have diabetes education. We have a pre-diabetes workshop, as well as we're offer the Prevent T2 Diabetes Prevention Program. So you'll find us on the In It Together website as a provider of all those services. And the Prevent T2 flyer, I see that up. We're getting ready to start a new group in September. This is a very evidence-based year-long intervention proven to prevent type 2 diabetes. It's for those people with pre-diabetes and at high risk for getting diabetes. So if you're interested in that, give us a shout and look on the In It Together website and find ones in your area. You may even be able to find online ones during the COVID situation.
I was going to ask about that. Are there effective online programs available? And I say effective because it does take, even in that flyer, we saw two ladies walking. So are some of the programs, one, virtual, and are they, are people going to get as much results as they would if they were in person?
Yeah, we've done a couple of virtual cohorts of the Prevent T2 program, and they go pretty well. It is a challenge to always be online. It's not as motivating to not be with your group of people.
Yeah.
But it's definitely effective, and they are out there. So they're out there all over the country and all over South Carolina.
Yeah, that's good. And then I know you have the Diabetes Wellness Circle.
Yes, the Diabetes Wellness Circle is just a diabetes support group. It's virtual. We have it at noon on the third Tuesday of each month, and it's open to anyone. So no matter where you live, you can join in on this. And you do have to register, so we'll send you the link, and we hold those on Microsoft Teams, so they are virtual. Looks a lot like what we're doing today.
Mm-hmm.
There's usually a moderator and a guest, and then you can interact with the other people as well. And if you want to sign up, you'll go to the SpartanburgRegional.com events page,
Mm-hmm.
and you just register, and it's through Eventbrite, and then we'll send you a link to join in the meeting the day before. And that's just a screenshot of the events page. So
right. Yeah.
Yeah. And
so this is what people would see. Yeah.
Yes, that's what people would see. You don't have to have diabetes. You can just be interested, and feel free to pass that along. That's open to anyone and everyone, everywhere.
That is great. So people just need to go on the website. I think we've got the information up. Do we have Erica's email address or the website for Spartanburg Regional up? Yeah. And then they will see that information, and then they can register for any of those, the Diabetes Wellness Circle or the Diabetes Prevention Program. If you want some more information or support, and this is great support, right, Erica? Just kind of step by step. Is that what it is? Kind of step by step information, advice, and just a support group, so to speak, for people to kind of make it through the program, make it through their health issues.
Yeah, the whole idea of a support group is you're not alone. You're out there with other people, and groups learn from each other. So it's really nice to have input from your peers and just interact with other people who are like you.
Mm-hmm, mm-hmm. All right. So listen, if people want more information, again, of course, they can email you if they want more information about anything that we've covered today. If they just want to go to the Spartanburg Regional site and check out some of these programs. And I love that you say you don't have to have diabetes. Because this is just good health stuff.
Absolutely. Yeah, it's good for everybody. And you might be a support person of someone with diabetes. So we're open for everyone. You're all
Yeah.
welcome.
Right, great. This is Erica Moore. She is certified diabetes care and education specialist at Spartanburg Regional. It's a National Health Center week, and we've been talking about how to manage folks' issues and illnesses with pre-existing conditions. And then, of course, don't forget, if you're just joining us, to hit the replay button, because we had a great conversation, very thorough conversation about the needs of healthcare workers amidst the pandemic and what you can do as family and friends to help. Erica, thank you so much for joining us today. This has been such a great conversation, so enlightening, such great information. And listen, happy National Health Center Week.
Oh, thank you so much. I appreciate it. I appreciate all you do.
Yeah, thank you. Thank you so much. I appreciate you too. So listen, if you have a story or initiative that can help someone cope with COVID, go to the TaylorMade production page and inbox us. We would love to feature you or your initiative or someone you know on coping with COVID. Do you have a product or service that could help someone cope with COVID? Please email copingwith@gmail.com. The website, the email address is scrolling at the bottom of the screen. And we would love for you to be a proud sponsor of Coping with COVID, just like all of our sponsors. SCDHEC, In It Together SC, the Diabetes Advisory Council of South Carolina, the City of Columbia Office of Business Opportunities, Palmetto Painting Services, Computers Unique, Dutch Square Mall. Also, the Comet Bus System, Javis Tax Services, Agape Counseling and Training Center, and the Fifth Circuit Solicitor's Office, Attorney Byron Gibson. Speaking of that, Byron and the Solicitor's Office typically joins us every second Thursday. That would be, tomorrow. They're going to join us next Thursday. No Justice, No Peace, every month with Attorney Byron Gibson, the Fifth Circuit Solicitor's Office, Richland and Kershaw County, South Carolina. That's going to be next Thursday right here on Coping with COVID. Tomorrow, Friday, we'll talk to Santana Hayes. He's with Midlands Fatherhood Coalition. He's going to tell us about all of the great things that organization is doing for Midlands fathers, or for fathers, and an innovative new program through the City of Columbia where they are giving single fathers monthly funds to help them take care of their children. That's tomorrow. Also, we're going to talk with singer True. He's a singer-songwriter, and we're going to do a Faith Friday session with him to talk about his music and his journey. That's coming up Friday on Coping with COVID. Now, a couple of weeks ago, we talked with Mike Goodwin. Remember, he was on America's Got Talent. Well, now he is a wild card contestant. And if you want to support him, vote for Mike Goodwin. Use AGT Wildcard and vote at Bowtie Comedy. You can vote now on Twitter, if you have a Twitter account, and vote for Mike Goodwin. So excited. If you missed that show, don't forget to check it out because he is so funny and so humble. Mike Goodwin, Bowtie comedian. He is from South Carolina, and we want to see him win America's Got Talent. So please make sure you do that. I want to say hi once again to Betty Fletcher. She says, thanks for the great information. Very informative. Thank you so much, Betty, for always watching Coping with COVID. As usual, I leave you with a reading from Jesus Calling. I'm going to read you yesterday's Jesus Calling because it was so good. It says August 10th. It says, relax in my healing. Now listen, let me say a sidebar. Healing could be physical, mental, emotional. It could be anything. Relax in my healing, holy presence. Allow me to transform you through this time alone with me. As your thoughts center more and more on me, trust displaces fear and worry. Your mind is somewhat like a seesaw. As you trust in me goes up, fear and worry automatically go down. Time spent with me not only increases your trust, it also helps you discern what is important and what is not. Energy and time are precious, limited emotions. Therefore, you need to use them wisely, focusing on what's truly important as you walk close with me, Jesus says. Saturating your mind with scripture. I will show you how to spend your time and energy. My word is a lamp to your feet. My presence is a light for your path. That's your Jesus calling for today, Wednesday, August 11th. I'm Trey Taylor. Thank you so much again for joining us for Wellness Wednesday from In It Together SC and the Diabetes Advisory Council of South Carolina. Until tomorrow, I wish you peace, abundant blessings. Stay careful, be safe, get your vaccine, and wear your mask over your nose and under your chin. I'll see you soon.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.